Welcome, everyone. I know some people had some difficult travels yesterday with the weather, so I hope you were able to relax and rest last night and are ready for a fully interactive and wonderful exchange here with your colleagues. For those of you who are new, I'm Jill Kagan with the Arch National Respite Network and Resource Center. And as many of you know, we house the Lifespan Respite Training Technical Assistance Center. So we are here to serve you and to provide the information that you need to implement your grants and run your coalitions and make respite more accessible. We are going to start off with introductions. I wanted to specifically welcome Victoria Wright, our Federal Project Officer from the Administration for Community Living, for those of you who haven't met her yet. Wave, Victoria. And our other esteemed guest, Heather Mene from the Evaluation Office at ACL as well. So welcome to both of you, and thank you for taking the time to be with us today. I also want you to meet our Arch staff, who I don't know what I would do without their support and many years of wonderful guidance and service. Cassandra Furman. You'll be hearing from everyone today. Ray Kirk and Susan Summers. Thank you all. I also wanted to recognize a couple of members from our Arch Advisory Committee to the Lifespan Respite TA Center who are just so committed and interested in what we're doing with Lifespan Respite that they make an effort to come with us and be with us for the grantee meeting, and that is Laura Widener with the National Multiple Sclerosis Society. We're so grateful for her support. Jed Johnson, I don't think he's, oh yeah, there you are. I didn't even get to say hello. Jed Johnson with Easter Seals, also on the Arch Advisory Committee, but he's here to make a wonderful announcement a little bit later today. And then we also have a few of our grantees who serve on the Arch Advisory Committee with us. Alicia Blader from North Carolina, Jennifer Abernathy from Tennessee, and our wonderful host, Melissa Terry with Alabama Respite. There she is. And thank you to your service on the Arch Advisory Committee. It's great to have your input too. I'm very excited to announce that we have 2 new states that we're welcoming into our Lifespan Respite Network, and I briefly want to introduce them to the group as well. And if I'm mispronouncing your name, I apologize. Sherry Flieger from North Dakota and Mary Welts from North Dakota. Welcome to the group. And from South Dakota, I have not met him yet, Derek, is it Beitler? Welcome to the network. We're so glad, we're very excited to have you join us. There are many other new faces in the room. Also, Mississippi, folks from Mississippi were not able to join us for the Learning Symposium last year, but I'm so glad they're here, so I wanted to just point them out to you as well. Kenyatta Blake Washington from Mississippi, and 2 representatives from the Mississippi Caregiver Coalition, Mary Kim Smith and Spencer Blaylock. So special welcome to all of you. And then I know there have been a lot of transitions this year too, new faces at Coalition. So when we go around the room, please let us know if you're new to the network. And we are going to launch right into the Bring, Brag, and Borrow in a few minutes, but let's just go around really quickly and just give us your name and what state you're from. And let's start over here.
I'm Deirdre Don Tierney, and I'm from New Hampshire. And I'm new.
Jeff Duncan from Nevada.
Corey Lutz from Nevada.
Jennifer Abernathy from Tennessee.
Pam Oliason from Idaho.
Good morning, I'm Mary Welts from North Dakota.
Cheryl Flieger from North Dakota.
Susan Reed from North Carolina.
Alicia Blader, North Carolina.
Susie Kiesling, Arkansas.
Derek Beitler, South Dakota.
Ann Wolf, South Carolina.
Here you go. Ellie Billman, Colorado.
Peggy Spalding, Colorado.
Julie Waters, Alabama.
Melissa Terry, Alabama.
Emily Kearns, Massachusetts.
Christine Schoenberger, Maryland.
Spencer Blaylock, Mississippi. I'm Jen Johnson with Easter Seals, but I live in the great state of Maryland.
Mary Kim Smith from Mississippi.
Kenyatta Blake Washington from Mississippi.
Good morning, I'm Robin Boswell with Oklahoma, and I had the Respite grant a couple years ago, then we didn't, and now we have it again.
Welcome.
Christine Santee, Delaware, and I'm new.
Karen Pateros, Washington State. Shannon Reynolds, Washington State.
Brittany Huey, Alabama.
Ashley Prater, Alabama.
Sharon Cackett from New York.
Dina Prest from New York, also new.
Laura Widener, National MS Society, Washington, D.C., not really a state.
Doris Green, New York.
Linda Stewart, Baltimore, Maryland.
Someone came in.
Oh, boy.
Casey Cunningham, Florida.
Can't get away from eagle eyes.
Two more sneakers in over there.
We need to know who you are as you walk in the door.
I'm late. Pam Heyer, Florida.
Thank you.
Jean Sherman, Florida.
Thank you. Are you coming in? I think.
Do I need this?
Yeah, let's just pass it around.
Oh, for bring back and
I think we're ready to move. They've introduced themselves.
Okay, good.
I just quickly also wanted to go through a couple of important things in your folder. Sometimes you get these folders and don't know the significance of everything that's in here. So of course you have your agenda for today. Okay, thank you. We are modifying the agenda just a little bit. The first 1, 2, 4 all session, we're shortening by about a half an hour so that we can add a half-hour discussion for our esteemed colleagues from ACL. It's very important information. We want to make sure that we get to hear from every one when we engage in our group discussion at that point. So lunch will be moved up to 12 o'clock so that everything in the afternoon is a little bit earlier. I forgot to mention that to you, Victoria and Heather. You'll have a little more time. Also in the folder is description of the sessions at the national conference that ARCH has identified as part of our lifespan respite track. So if you're having trouble deciding among all the wonderful sessions at the conference that starts tomorrow, this will give you some guidance to know which sessions are being presented by your colleagues from other states, or sessions that might be of particular interest to you as you're implementing your lifespan respite grants. That's in your folder. The other very important document is this green evaluation form. I really would so appreciate it that before you leave today, that you complete these, and you can just leave them in the middle of your table. I'll remind you again, before you leave, if you would just take 2 seconds to fill this out, it would be very helpful. We're gonna have other things for you to sign today also as the day progresses. And then this is a document we gave out last year that Cassandra put together. It's a wonderful little infographic on how to make sure you've got the right stakeholders in your coalition. But we've gotten a lot of positive feedback from it from last year, so I just wanted to make sure you all had another copy of that. And we have a few more that I can send you if you're interested in that. You also received another copy, many of you should already have one, of the Measuring Outcomes Guide, because that also will be an important part of the discussion this afternoon when we are talking to Victoria and Heather about new data collection issues. I thought it might be a handy reference for you all to have that. Those are the basically important things that are in your folder. At the end of the agenda, you'll notice that we have a short time set aside for the Sustainability Learning Collaborative to meet, and you're going to be hearing more about what the Sustainability Collaborative is from Susan later in the agenda. But I want to point it out to you now in case some of you might be interested. We're still welcoming new members to the collaborative. It's basically peer run by several of your peers from other states. We've had a couple of calls so far, and we're making great progress with that group. So if you're interested in being part of that process, you might want to plan to stay for that little extra meeting tagged on at the end of the agenda. Now we're going to move into the bring, brag, and borrow. People really love this part. I hope you still love it when we're done, because I'm going to be a lot stricter about the time. But essentially, it's a rapid release of information about one specific highlight or activity or success or anything that you want to share with the network since we were here last year. We've asked you in advance to prepare for this, so hopefully you all had a chance to do that. One person from each state will have 2 minutes to talk about their activity, or one state has sent a video to share, or if you want to leave materials and don't have a lot to say, that's okay as well. Whatever it is you've decided to do is fine during this bring, brag, and borrow. Again, one person from each state, 2 minutes. And this year, when your 2 minutes is up, you're going to hear this. And if you keep going, you're going to hear this. I hate to do that to people, but we really want to keep on schedule for the day. And we will proceed alphabetically by state. So when I call your state, whoever was identified by your group to be the spokesperson will bring a microphone to you, and we'll start counting down your 2 minutes of time. So let's start with Alabama, since they're also our wonderful hosts for this whole event.
All right, so I'm going to talk about 2 things. Last year we mentioned doing a caregiver simulation, starting it and kind of planning it and putting everything together. We have done that successfully, and we've done it in several universities in North Alabama, and we have also done one in the community, and we are fixing to take that statewide for University of Alabama, and then we've got one set up for UNA next spring. We will have a session during the conference, so if you want to know how to do that and implement that in your state, our community partner is actually going to be the one doing the session, because we figured we would be pretty busy with Jill. And then the second thing is we wrote for the Lifespan Grant. We have a lot of caregivers that call, they're taking care of somebody with a mental illness or maybe cancer or COPD, stroke, something like that, and we don't have funds for those people. We have funds for those caregivers taking care of somebody with an intellectual disability or developmental delay. So we wanted to have something to offer those other caregivers that provide the same hours, the same duties. They're stressed and burned out as well. So we did get that. So now we have a universal voucher.
That's all I got. Wonderful. Thank you. I did want to remind you, this is important. We did move the grantee meeting to the front of the conference, because one piece of feedback that we had was that when you hear all these wonderful things this morning, you want to be able to have time to connect with the colleague that is sharing that information. So make sure you're jotting down who it is and what they're talking about. If you want to have a chance to meet up with them later, you've got the next today and the next 2 days during the conference to make those connections. So that's just a reminder. Okay, next state, Arizona. Thank you for staying under your 2 minutes.
Did someone, Arizona? Back here. Oh, the dark side of the room. Okay, you guys, I think there's places to sit where there's light. We'll move you later.
Can we get some lights over there?
That's okay. Yeah, anyway, my name is Dorothy Kelly, and I'm on the board of the Arizona Caregiver Coalition. And recently, we just got a grant to provide respite vouchers for adult daycare. So we're going to start administering that grant probably within the next couple of months. We're going to be hiring a person to help coordinate that and get that going. We have probably, I want to say, and this is for the whole state of Arizona. And when you consider the whole state of Arizona, we have a lot of rural areas as well. And so we don't have a lot of adult daycares in rural areas, but we're going to be working with all of them. And so we're really excited to get that started. This is Cindy Finley, who is the Executive Director of the Arizona Caregiver Coalition. Did you want to say anything else?
Good morning, and how was that bacon today? That's about all I have. Dorothy Kelly is on my board of directors, and we're very, very happy to be here. Thank you.
Next state, Arkansas.
Yes, I'm going to tell about one of our, kind of brag about one of our mini grant projects that our Lifespan Respite grant funds. It is called a Yoga for Caregivers, and this is a program that it's through a nonprofit that provides education and services for families with individuals with developmental disabilities and intellectual disabilities, and they provide a lot of free recreational activities for these families, but they have never done yoga for caregivers, and this was just something that this grant made available for them to be able to do. And they are planning to do 20 events. Every other week they do an event. It's an hour-and-a-half session, and it accommodates about 20 caregivers. And at the same time, they have an adapted program, a yoga class, for the individuals that the caregivers are caring for. And if some of those individuals are not interested in attending that, or are not able to attend that, then they have also other care, qualified care in another area of that building that's available. Or if the person needs to be at home, is not able to be at attend that program, they also provide vouchers to have someone go to that home to provide respite. So this has been really well attended. They've had 7 events. They've had served I think 33 families up to this point, and I brought a binder and with some pictures of some of the events, and there's a handout that gives more details about the actual program.
Wonderful, thank you.
I also put just an agenda of our summit. We did a summit this past year, so our second summit. So I just to show some of the presentations that we had at our summit.
Excellent, great. Colorado.
I'm Peggy Spalding, I'm with Colorado, and we have been doing a lot of great things. We have a great voucher program that I know that a lot of you have been doing. We served over 160 unduplicated consumers with 9,000 hours last year. If you have any questions, Ellie's sitting right here. The 2 things that I want to talk about that we implemented this year is our stress busting. At last year's conference, many of you may have attended that, and there was a presentation about the evidence-based stress busting for caregivers. We had a training, and we trained 12 individuals to be master trainers within the state. So now we're going to start training the trainers, and those classes, those sessions with the caregivers have just been fabulous. I put one of the family caregiver books over there, the workbook that they're provided with all the DVDs. And then we also have started what we call our employer engagement wellness kit, caregiver wellness kit. And we go out to the various employers. We do presentations, a lunch and learn, and we provide a kit. There's one over there. We put it in this plastic container. We have this notebook that has a spiral, it's spirally connected. It has a lot of resources. It also talks about ways of relieving stress. We provide coloring books with coloring pencils, and we also do some journaling activities, and so we provide them with a journal. This has also been very well received. We've done approximately 10 different employer engagements, And this year, with the new grant, we're hoping to increase our faith-based communities.
Thank you. I did also want to mention, I forgot to mention this initially, and I hope none of you object. We did have several grantees at the end of last week who had to cancel because of family emergencies or illness, and they so desperately wanted to be here and to hear especially this Bring, Brag, and Borrow session. So we are videotaping this for the first time. We will not share it widely. We're just going to share it with the grantee network and for our own internal use, but I did want you to be aware of who that gentleman was in the background, and very generous of Alabama Respite to help us videotape today. So thank you. Delaware?
Hi, everybody. I'm Christine Santee. I am a case manager for the Community Outreach Program for Easter seals in Delaware, one county in Delaware. And I also work in the Caregiver Resource Center. We had something to brag about. We had a caregiver conference, and it was really successful. We had 220 registrants, 35 exhibitors. Our program was the 7th Annual Caregiver Conference, Take Care of Yourself to Take Care of Others. We had the program was a collaboration with a women's magazine, and she did a beautiful job with our program. The morning was learning, and the afternoon was about self-care. There was chair yoga, guided meditation, and Peter Rosenberger, who is, I believe, from Tennessee. There were very positive comments from the attendees and the exhibitors. Thank you.
Great, thank you. Florida. I cue that up.
Hi, I'm Casey Cunningham, and I'm from Florida. And we have a video to share. It's an educational video that we created for our website, and it's 2 minutes. So I will not talk. I will show the video.
And you can talk to Casey afterwards if you have any questions.
Yes.
Thank you. He's going to show it for us.
Great.
catchy. Idaho?
Right here. I was waiting for someone to stand up.
Thank you, Cassandra. So last year we created, and I think I might have mentioned it at the meeting here, the Idaho Lifespan Action Plan. And the action plan took about a year to create by the Idaho Caregiver Alliance, which is led by the Idaho Commission on Aging, where I work, in Boise State University, the Center for the Study of Aging, but where we have many organizations that represent children and middle-aged people as well. The plan includes respite as well as other support services and policy and systems changes. We took the plan to the legislature and presented it to both houses of the legislature, and it was unanimously supported eventually after about 50 visits to various legislators. And now, this year, we've been working on trying to find a home for the plan, a home for implementation of the plan, because it wasn't a given that my organization, the Idaho Commission on Aging, would be the lead. In fact, many people questioned why a lifespan program would reside in the Department of Aging. However, in March, we had a new administrator come to our organization, and thankfully she understands lifespan and she sees it as a perfect fit for the Idaho Commission on Aging, and understands that we will be working with our broad network continually on this work. So she is going to take the plan this year and look for funding support from the legislature, which was our next step. So that's where we are right now.
Excellent, thank you. Is Karl here from Iowa? Oh, great. Behind you.
Hello, I'm Karl Lincoln with Iowa Lifespan Respite Coalition, and I guess our thing a little bit to brag about is, even though it may seem very common for other coalitions, we actually got our Lifespan website up and going with testimonials, information, and we are also working on a video as well that will hopefully be out here by this next spring coming out. The other thing is really focusing on training in our rural area in Iowa, and so we actually teamed up with Easter Seals to help provide some family caregiver training focused in about 6 rural areas around Iowa, averaging around 20 or 30 individuals being trained at each location. So we found that very successful, found it very valuable. Where there's training resources in the urban areas, we find a big disconnect, at least in Iowa, in some of the rural areas. So that's one thing we kind of worked on.
Great. Maryland.
Hi everyone, I'm Deirdre Adams, and I'm with Maryland. I'm just standing up to say hello, because it gives my heart so much joy to expand and have colleagues here,
partners and teammates, to actually talk about what we're doing in Maryland. But it is wonderful to be here.
Hi, I'm Kathleen Ward. I'm also from Maryland, and I want to talk about something that we've started. I know we only have 2 minutes, so I will talk fast. We've done a lot in Maryland. We have a lot of committed partners who have been helping us, but there was one issue that we wanted to resolve with the Lifespan Respite Grant. We are very fortunate in our state to have a number of respite programs. They go across the lifespan in some cases, so there is respite care available for people, many people, when they need it. But there is a niche that was unserved. It is not too difficult to get respite if you are planning ahead, if you know that you're going to need it in 2 weeks, if you know you're going to need it regularly over every month. What is hard is to find respite for an emergency situation that happens and you need respite tomorrow or the next day. And sometimes you don't have an application process that you can go through that will get you that emergency respite. You may be able to get some retroactive, but you're left really trying to cobble together a plan. Well, we partnered with with a personal care agency in our state that has been a committed partner in the respite area for many, many years. And we have developed a respite emergency program so that if somebody has a true emergency, they have one number to call that will serve them across the state, across the lifespan. They can get an approval within 48 hours for emergency care. The emergency care can be in the shape of a subsidy that they can use to pay for respite care, or the Elizabeth Cooney Agency will provide a professional person to do that for them. It's taken a long time for us to get this procurement process through. We have just started the program. I have flyers I'm going to leave outside for you if you want to see the parameters of the program. But we have just served our first 2 folks with an emergency grant. So we're really pleased and very happy that we were able to do this with the Lifespan Respite Grant.
Maryland was also featured on our last network teleconferencing call, talking in more detail about this. We're moving on now
I want to give real quick, because of partnership. That's why I'm not talking. Okay. Turning it over to Christine.
And I'm with the University Center for Excellence in Developmental Disabilities in Maryland. There's one in each state, so you each have one at your states at home. And it's been a really great partnership because what we've been able to bring to bear are some of our resources around technical assistance and capacity. So our contribution has been around technology and software. So we've started using a cloud-based data management system to look at all the data that Maryland collected for its statewide survey. And we're now using a tool called Smartsheet to track all of our data related to the activities of the Commission and Respite. And I'm happy to answer any questions. Right, and I'm also representing the Maryland Respite Care Coalition, which has recently been reborn in Maryland, and it's been a lot of fun.
Massachusetts.
Hi, good morning. I'm Emily Kearns, and I help with the evaluation of our mini grant program. And we've just completed our 3rd round of mini grants. And it was specifically aimed to serve the hard-to-reach folks, cultural and linguistic minorities, and also the LGBTQ communities. So some of the takeaways, we're still doing the number crunching, but the more qualitative findings that were presented at our summit, which is always so inspiring, include the following. The first is, in terms of reaching out to the LGBTQ community, trust and relationship, of course, is an issue. The older folks are saying drop the Q for queer, which is really a huge takeaway, actually. So big generational difference. Folks don't want to self-identify. They said embed respite in the more comprehensive social and health outreach to reduce isolation. So don't come out and saying we're offering respite for the LGBTQ community specifically. Huge, huge takeaways there. In terms of workforce stability, some of the challenges the grantees had was staff changeover takes time, and within an 8 to 9 month grantee program, they really don't have time to train staff and mobilize a workforce. Let's see. Fear of government. So we had one grantee serving the Brazilian community, especially in this current political context. They said that respite doesn't have the same meaning. We know that it needs to be culturally specific in terms of the marketing, messaging, and the outreach. They were brilliant. They used the Brazilian radio station, and huge, huge success. They also reached out to the Brazilian churches. So that's a great takeaway for us, especially because of the fear of the government right now. Let's see, the other consistent, this is our 3rd round of funding, as I said, is that there seems to be, although not statistically significant, some kind of correlation or relationship between, and it's not rocket science, it makes sense, but the level of care of the care recipient and the stress reduction. So the higher the level of care, the greater the respite programs are impact. So this is consistent across every year. Let's see, we also had an innovative program that was a memory cafe, and we're going to present on that. So I welcome you to that session because we'll be talking about the cafe model that comes from the dementia-friendly world, but it is serving now, across, for the lifespan respite. So thank you.
Thank you, Emily. Mississippi.
All right, good morning. We are fairly new to this arena, but we're very proud to be a part of it. I do want to report that legislatively since 2014 we've been able to create a caregiver agenda, a blueprint for Mississippi. We have had legislation every year on the books and passed legislation every year except this year. Mississippi is the poorest state. We're usually at the back of everything, but we are still on the agenda and we're still planning for legislation this coming year. We've had our first Respite Summit and we're having our second Respite Summit in November. We've had one rest training and we plan for another one by the end of the year. So we're proud of those things because it takes a lot to turn this system around. So thank you.
Thank you, Spencer. Nevada.
Hello, my name is Jeff Duncan. The first thing I'd like to talk about was our grant that we're closing out. Due to my intense competition with the state of New York, we were able to sustain a couple of the interventions that we piloted in that grant, one being the respite education and support tools. So I am fortunate to have 3 statewide master trainers now, and we have quite a few trainers throughout our large state and companions across the state now doing respite, and that's outside of just the private world or paid world. We also have some volunteers that we've actually trained in that curriculum. So that's fantastic, and I just love beating up on New York. Love you, Doris. So, in addition to that was our care consultation through the Rosalind Carter Institute. We were able to pilot that in the last grant, and I was able to now embed that. I have 2 care consultants. That's a telephone-based empowerment program, if you're not familiar with that program, within our Aging and Disability Resource Centers. So I have one in the north now and one in the south, where I have all 17 of my counties now covered through that telephone-based program. So that's very exciting. So then huge shout out to ACL. Thank you for funding us for the brand new grant, where we're gonna focus on really beefing up our coalition. Over the years, we had many activities around this, but they are gonna explore potentially becoming a 501c3 to be able to bring in funding. But what we plan to do is hire an individual who will become potentially the executive director, and basically we'll hire them through the grant, and then they will fight to sustain themselves. So the coalition will have a foundation and be able to move forward even without funding. So that's a big goal for us. And we're gonna revisit our Lifespan Respite Strategic Plan, explore universal respite packet, or cross the application across the board, and a lot of other activities to support our coalition. So we're really excited and very thankful for the funding. Thank you.
Thank you, Jeff. New Hampshire.
Hi, I'm Deirdre Don Tierney, and I work with the Department of Health and Human Services in New Hampshire. And I came into the position last April 1st in 6/15, so I didn't really think it was an April Fool's joke, but I came into Respite thinking, what is this? There was a Respite Coalition that had been formed. There were 3 individuals that routinely came to the meetings and were really looking for a leader to take over the work of the coalition. So I spent the last year really researching the roots of the coalition. We conducted a survey of the original coalition members to ask the question, is this still an issue? Because nobody's coming to the table anymore, which of course I'm hearing from the families that it's definitely still an issue. So I know, but I needed to bring them back in. We're in the process now of planning a mini summit to look at what is needed in New Hampshire to bring the right people back to the table, to relook at the strategic plan that was written back about 5 years ago, and where the gaps were and what we need to do in order to rebuild that pool. We also have we use the Rewarding Works website for families. We do have an online training available for respite providers, and we're still doing some referrals. But the workforce issue in New Hampshire is really a huge problem for us. Our families are not able to find providers that they're comfortable with, even if they're trained. So we're also looking at how can we help educate families and inform families on what a good quality respite provider looks like. And so we're looking at ways to bring families into the coalition as well.
Fantastic. That's great. New York. Bring it on.
I don't need a microphone? Okay. It's right behind you. Yes, it's right behind you.
To address Mr. Duncan, he said at Bring Brag and Borrow last year, game on, New York. So I've been driven through the last year. And so we instituted respite education and support tools as well in New York. We have a great partnership with the New York State Office of Aging, who helps to fund that. We have 121 trainers throughout the state. We have 6 master trainers. We have 112 companions. I know you're beating me on that one, but I will get there. So we've built this great foundation to be able to do a statewide initiative to increase the volunteer respite workforce throughout the state because of the workforce and the workforce shortage that we have in the state as well. The other cool thing that happened last year, a lot happened at Bring, Brag, and Borrow for me last year. So Melissa Terry starts talking about the Caregiver Simulation, and I almost fell off my chair. So in the spring, I was fortunate enough to come down, stayed right here at this lovely hotel, and experienced the Caregiver Simulation with the Alabama Respite Coalition. They gave me everything I needed. We went home, and we've done it 3 times. We've done it for 135 people. We've had incredible feedback of how great this is for helping to really raise awareness of what caregivers go through. And the third thing is that we did our annual state conference just last week. We had 135 people. We focus on professionals working with caregivers in order to help them be able to do that more effectively. So we're pumped. We got a lot of good stuff going on, and we'll be here next year to, well, not here, yeah. Next year to brag about all the good stuff that's happening in the future. Thank you.
Great. Thank you, Doris. North Carolina.
So I'm Alicia Blader with the State Unit on Aging in North Carolina. One of the things that we thought to bring to talk about, you'll see it over on the borrow part. We weren't sure whether it was a bring, a brag, or a borrow, but we put it under borrow. It's a green sheet. On the top it says setting goals to maximize your respite time. Years ago we got involved with Dr. Dale A. Lund and really was reading a lot of research about what caregivers do with their time when they have respite and how that makes them feel, the reduction of burden that brings about. And so with Dr. Lund's permission, we adapted some of the work that he had done to a one-sheet planning tool. We give this out with all of our respite programs right now. We don't require that caregivers bring it back, but we ask them to think about what do they want to do with their time. We had done a test in, I believe it was 2012, where we tested with caregivers a pre and a post, and we actually paired them so we knew we were getting the same results from the same people, and found that the only caregivers who had a statistically significant reduction in their burden scales were ones that reported that they used a planning tool to be able to determine what they wanted to do with their respite time. And so we don't dictate what they do with their time, but it's one of the things that we've encouraged caregivers, this is your time. This is your time to be restored. This is your time. Use it however you want. But this gives them an opportunity to get a little bit more permission to think about what it is they want to do with that time. So that's something that we've continued to work on just kind of slowly with all of our respite programs. It's through our Lifespan Respite project. It's also through our Family Caregiver Support Program and something called Project Care, which is our state dementia care respite caregiver care management program. So that's what I brought for you. I'm probably out of time. We have
30 seconds.
Susan Reed and I, Susan works with us in North Carolina doing a fabulous job. We have a workshop that we're talking about what we found in our respite vouchers, why caregivers choose not to use those or maybe don't get around to using those.
Great, thank you. North Dakota, I know you're brand new and you may not have a success to report, but if you'd like to share what you plan to do, that would be great.
Good morning. Yes, we've had the grant 6 weeks, so we have a lot to brag about. I'm ready to throw up and run out the door. I don't even know where to start. Thank you so much for everything you've shared. As Cheryl and I were talking about this portion of the agenda, we thought that we would like to share with you why we are here. We have such good legislative support in the state of North Dakota. There was an interim committee that commissioned a study to be done by North Dakota State University on caregivers, and this is the booklet, but we have brought with us the executive summary that, yes, there's things specific to North Dakota, but we're hoping that there may be something in there that each of you will find helpful to take back to your states to use as well. And it's just been a treat so far to be here just this hour, so I can't imagine what I'm going to be like on Friday afternoon. So thank you very much. Cheryl, did you have anything?
Wonderful, welcome. Oklahoma.
I'm Robin, and I didn't know I was going to be speaking either, but I can think of some things that when we had the grant a couple years ago that we worked through DHS Aging Services, but I actually work for a program that works more with children and young adults, so we were able to merge the aging with the population that we had always worked with. A couple of the things, when we didn't have the grant, we still had caregivers calling us every single week looking for respite vouchers. So we did a bowling event and we called it Desperate for Respite. And we had caregiver t-shirts for sale, and we got sponsors, and we had 65 bowlers for a first-time event. We thought that was really good. We had 10 sponsors at $1,000. But you have expenses, of course, too, but we were extremely happy, and that was really fun, and we created a lot of awareness. Also, another thing we do in Oklahoma is we partner respite with SIB shops. I don't know if any of you have ever heard of SIB shops for siblings that have a brother or sister with special health care needs, and we get a faith-based entity to sponsor it, and on a Friday night or a Saturday morning for about 3 hours, we have a SIB shop going for the siblings, and then we have respite for the kiddos with special health care needs and young adults as well. And the faith-based community provides the volunteers for the respite side, and then we have a trained person for SIB shops. And so that's been really successful, and we're carrying it into the new grant as well. A third thing we do that I haven't heard anyone mention is educational vouchers. So if you have a workshop that involves training that a caregiver could benefit from, we provide educational vouchers, a whole day, $100 educational voucher, half a day, $50 educational voucher. They have to come to me. I attend the event and issue the vouchers. It's carried out just like any other respite where, you know, it's paid after the service has been provided. But we did that 2 years ago, and we will do that as well. That's a big thing in Oklahoma too. So just a couple of things we're going to continue into this new grant.
Thank you. Our next state is South Carolina, and they're way over on the left here.
Hi, I know I'm going to be the first one Jill spoons, but that's okay. Because it sounds funny, doesn't it? Because listening to you all has changed a little bit what I want to say. For those of you who are new especially, we have been fortunate enough in South Carolina. We were one of the original 12 in 2009. We have had a lifespan grant running ever since, and we were fortunate enough to get a new one this year. I can tell you it has been instrumental in changing the landscape of respite in South Carolina in a way that I would never have imagined when I first got involved in 2009. So for those of you just starting, I am so excited for your journey, and if there is anything that we can help you to achieve as you go along. We were talking among ourselves last night about folks who didn't know the word respite when we started. And now caregivers are calling, and they know that word, they know what it means, and they know what they're asking for. That's priceless. We would not have been there. I'm in a state unit on aging, and we also went through that issue of what is lifespan doing with age. Wow, we are so far past that. One of the things I brought to share were a couple of promotional items that we were able to make. We have a logo that we branded in our last grant. It took a little bit to, I work for an elected official, a constitutional officer. That's how we're structured right now. And so it took a little bit to find the administration who was willing for us to put that brand on our items, but we're there. So I hope that you will take, we have a little notebook, a magnet. The other thing that we're doing right now is we are trying to get employers on board, because so many caregivers hold full-time jobs and so many employers aren't aware that their employees are also family caregivers. So we have reached out to the South Carolina Business Coalition on Health, and what I also have back there is a little hybrid infographic rack card that we created. I hope you will feel free to take a couple if you like. What we're doing is trying to get the message out to them, whether you know it or not, you have family caregivers among your employees, and it is impacting their performance, their presence in the workforce, and how much they're going to be able to contribute to your work. And we have some big manufacturers in South Carolina. We have Boeing, we have BMW, Michelin Tire. So these folks are part of this consortium where we were able to speak. The other thing I want to say, what grew organically out of this Lifespan Respite grant process was a partnership, what we call our Bridge Group. And it is folks who we've been working on several state plans, one of which is updating our first Lifespan Respite state plan. So these are folks who have a stake from a different perspective. That is vital. I encourage you to find the people who have the interest, maybe in areas that you wouldn't commonly link to. What do they have to do with respite? You would be amazed. And so this has already borne fruit. We've already heard back from the Business Coalition on Health. One of the major manufacturers in South Carolina has reached out to them for these little mini grants that are available. And she immediately thought of us and said, what can we do for family caregivers with this mini grant? So I encourage you all. I'm so excited and I'm thrilled to be here. Thank you for not spooning me.
It's such valuable information. I hate doing the ding, so I'm glad I haven't had to do it at all. South Dakota, another new member of our network.
Like North Dakota, we just got our grant, so I'm excited for this long list of things that I get to do when I go back home. I just found out like 3 weeks ago I was even coming here and part of this, so I'm excited to get started and learn from everyone else.
Great, welcome. Tennessee.
Well, we've been really busy in Tennessee. This past year, we've partnered, of course, with the Tennessee Commission on Aging and Disability, and held 4 community conversations around the state, using kind of a modified World Cafe model where we ask 3 questions and have people at the table discuss those questions, have a scribe at each table, and then we took each table after the 3 questions came up with their 3 most important solutions for respite, and then rank them, and so we have tons of data. So we had over 80 people attend those 4 sessions, and then we also did the same thing with an online survey, and got about 100 responses to the online survey, so we've got even more data. But it's going to be all good, and hopefully, you know, we'll get it together and get it into a plan format for the state. You might have seen online just this week, we started a Facebook group, the Reading for Respite, a caregiving book club. And I think we're up to like 34 members, and I just posted it like Monday, so. So there's information back on the Bring, Brag, Borrow table for that with the link that feel free to join. The first book that we're discussing is by a Tennessee resident, Kimberly Paisley, Brad Paisley's wife, who was caring for her mom with Alzheimer's, she recently passed away. So that's our first book that we'll be looking into this quarter. Tomorrow, Friday, we'll be presenting Music in Memory. If you're not familiar with that, it is wonderful, and we've added it into Respite in homes. So it's very exciting, and so come to that session. And one last thing that's on the back table, we had some grant money that to do some promotional stuff, and we made chargers that's Recharge with Respite, cool. Branded TRC in our website. So take one, and I've got more if there's not enough back there.
Awesome, thank you, Jennifer. And Washington State, they're way over here.
Good morning, everyone. I'm Karen Fitzharris, and I am new to the Respite program, and very excited about learning more and doing some good work. First of all, I want to thank ACL for giving us some additional grant funding for the next 3 years. And with that, we will be focusing on 2 new populations. I'm expanding upon one, tribal folks, as well as those living with a traumatic brain injury. So we have some great partnerships happening, the TBI Council. We have 16 tribes in Washington State that we will be building upon. And with that, we will be doing a survey because of these 2 populations. We know the traditional care giving may not be what they need, so we're excited to hear kind of what they think respite is and how we can better serve their caregivers. We also we'll be doing a streamlining on our voucher system or processes because we have several different respite programs. We have, foster care, DDA, aging, many of those Department of Health, to see how we can streamline the application process because we know many of the providers out there are working for several different programs, so it gets confusing as far as what billing and what application process we need to do for the various programs. So we'll be doing that as well. And I'm going to hand it over to Shannon to talk about some of the things we've done here last year.
So this will be very quick. Good morning, everybody. I am here in place of Linda Porter, which many of you may know her. So I work side by side with her. And we are very excited, as Karen has said. Again, thank you for our new grant. We're very excited for that. We work with our tribes in Washington State, and we actually do some training for them. We usually do what's called the NEAR program, so it's Neuroscience, Epigenetics, Adverse Childhood Experience, and Resilience. And this is in connection with the Healthy Generations in Washington State, and so this is a really amazing program. I actually got to go for the first time, and it was really amazing to see how adverse childhood experiences can really affect a person's health throughout their lifespan. And then we're able to really make those connections with the caregiving world and hopefully explore a little bit more about how we can connect, especially with our tribal members, in providing them respite support services and creating their own respite services within each tribe. So thank you.
Exciting. Great. Wonderful. Did I inadvertently miss a state in my inability to alphabetize correctly? No, we got everybody? Excellent, and we are like exactly on time, I think, and I didn't have to ding anybody, so that was very substantive, very beautifully done, and thank you for sharing all that information. I wish that we had another few hours just to expand on these conversations and give you time right now to talk to each other, but as I said earlier, at least now you've been able to identify your colleagues. You've identified some interesting projects or products that they've developed that maybe you want your state to learn more about. And now you'll have a little more time this year to pursue those contacts and make those connections. So thank you all very much. And we're going to move right on to our next presenter. I'm very happy to introduce Victoria Wright from the Administration for Community Living, and she's going to give us the latest on lifespan respite.